Concepts and misconceptions about Ayurveda. Even the Indians have many misconceptions regarding Ayurveda. What to speak about others? The basic reason behind this is our educational system. Any portion of Ayurveda has not been incorporated in the curriculum either at school level or at the graduate level. As a result, everybody makes his opinion as per his experience. The major misconception is regarding the scientific nature of Ayurveda. Since all modern sciences have been considered as sciences, the consideration of Ayurveda as a science is also in the perspective of modern sciences. Therefore, people often say that Ayurvedic system should be validated and one should prove its benefits using modern techniques. They just can't think of a science which is of totally different nature. As a matter of fact, it is very difficult to even understand the concept due to a very different kind of background in which they have learned up till now. They can't consider even different ways and different kind of cause-effect relationship to understand it as a separate science. I came across a case of a small boy of age 12 years suffering from spring catara, an allergic condition of the eye in which there is itching and the eye turns red. Initially, he was given anti-allergic drugs, to which he responded nil. He further did not respond to local steroids and started developing corneal opacity. He was then suggested a systematic steroid and ophthalmologist then referred the case to me to see whether Ayurveda can help him. I started taking the case history and asked questions about his daily routine, kind of food, its frequency, etc. I found that the parents are feeling very strange and ultimately I did ask them the reason. The boy is suffering from disease of the eye and what the hell you are asking about his diet? Was the question posed by the parents. I could immediately understand the situation because there isn't a single experience where the ophthalmologist asks any patient about diet. He may even diagnose a patient as having vitamin A deficiency and prescribe vitamin A, but will not try to see whether the diet is deficient in vitamin A. So there is no concept at all to look for the dietary causes in ENT or dermatology or gynecology. Our body is made up of food material and food is the main reason for varieties of diseases associated with various body parts. Though modern medicine fails to recognize any diet cause, it is called scientific. The question arises whether to consider Ayurveda, which recognizes causes not only at the diet level but at the various levels as well, is really a scientific or not. For any science, cause-effect analysis is unavoidable because that is really the basis to understand the disease and treat it. This boy was consuming curds, pickles, bananas, etc., giving rise to excessive kapha in the body leading further to disease. He was advised to avoid these substances and was given Vamana treatment, a scientific treatment for producing emesis to expel out excessive dosha from the body. The boy was cured. This example is quite evident to prove the cause-effect relationship and the scientific nature of Ayurveda. When you go into details in case history of each patient, the lifestyle, the food habits, the addictions, the stress, etc. are found as causative factors for various diseases. But one needs to understand them from Ayurvedic perspective and get freed from the diseases. The doubt about the scientific nature of Ayurveda is the main misconception giving rise to various other misconceptions. When a particular person gets cured from a particular disease, say for example hyperacidity, by Ayurvedic treatment, he has a strong notion that Ayurveda has very good medicines for hyperacidity. So he would refer other patients of only hyperacidity to that physician. But other patients suffering from sinusitis, bronchitis, cancer, etc. will not be referred. The very fact is that Ayurveda is a scientific system capable of handling all types of cases, including that of surgery. Very few people know that Sushruta is the first plastic surgeon of the world. Therefore, Ayurveda is being just not a tradition but a scientific system which has given rise to various traditions. Another important misconception is the slow effect of Ayurvedic treatment. Generally, a patient approaches Ayurvedic physician after having suffered for many years in spite of modern treatment. Naturally, one requires more time to get cured from chronic diseases. Still, one should get at least some relief in maximum 7 days. Otherwise, the diagnosis and or the treatment have to be reconsidered. The treatment may continue few months for complete cure, but surprisingly, people remember those months of progressive cure and forget suffering of years. They don't tell others that they had been suffering for years, but boast about Ayurveda that they took 6 months medicine and got completely cured. This leaves an impact that Ayurveda is very slow acting. I have handled varieties of emergencies like acute appendicitis, cholecystitis, and heart attack, etc. successfully with Ayurvedic treatment. The only requirement is the proper knowledge of text and experience. Another misconception is about dietary restrictions. Actually, for any medical science, knowing the cause and asking the patient to avoid it is mandatory. But in modern medicine, due to the technique of symptomatic relief, even without knowing the cause and avoiding it, the symptom is relieved. This creates an impression that modern medicine doesn't require any restriction on a diet. This is rather a weak point of modern medicine, leading to failure, especially in chronic diseases associated with lifestyle. Say, for example, a patient with colitis must be asked about eating outside in restaurants and should be advised to stop that. Especially in countries like India, since modern medicine is not advising any dietary restriction, in comparison with Ayurveda, the patients get a feeling that modern medicine doesn't require any restrictions on diet, etc. As a result, modern medicine has become more popular, making Ayurveda rather unpopular due to prescription of logical restrictions. Let us understand this by a simple example. If we are driving a vehicle and if we want to stop, the first thing that is required to be done is to bring the acceleration to zero. then switch to lower gear, and then ultimately apply brakes. In the same way, in order to cure the disease, we should stop all accelerating causative factors, turn towards healthy lifestyle, and then use medicines, treatment to cure. Another big misconception is the use of heavy metals. With the introduction of Rasa Shastra, the use of mercury and other metals like gold, silver, copper, etc. has begun in Ayurveda since the 7th century. Their effects are seen instantly and in a very small dose, and there is no question of palatability. That is why they got acceptance in Ayurveda. Ayurvedic physicians use them even today. But these all are toxic in nature, and Ayurveda knew it from the beginning. So special purification process, Shodhana process and Marana process leading them to Bhasma were used to detoxify these metals and enhance the benefits. If they are prepared in a scientific way, they are 100% non-toxic and safe, yet instantly effective. The government of India has now adopted the policy of good manufacturing practices to ensure the non-toxicity of the raw material. Even herbs can be contaminated due to pesticides and auto-effluents and of the finished products. Hopefully, this problem should not arrive in the future. Patients are requested to use medicines from honest and trusted sources only. Especially the lead toxicity has been reported to lead to kidney failure. On the other hand, there are many evidences that Ayurveda benefits CRF patients, which have no other choice than lifetime dialysis or kidney transplant. There is another misconception such as hot and cold nature of the substances. For example, curd or yogurt is supposed to be cool. Hence, it is consumed in summer. But in reality, as per text, it is not, it is hot in nature and should not be consumed in summers. It increases pitta dosh as well. So also the buttermilk. It is also not preferable in summer season. The only good conception regarding Ayurveda is it goes to the root cause of a disease and cures it completely. That is true, and that is why Ayurveda has survived these many years. With this background, let us try to understand the concept of health and disease according to Ayurveda.